Hello.
Yes.
Hello.
Okay. You start.
Hello. हाँ मैडम. Hello. Hello. Screen share. Full
हॅलो.
screen.
येस सर.
हाँ
सर
मॅडम.
अगोदर इंट्रोडक्शन. हा सर, मी स्टार्ट करून देते इंट्रोडक्शन वगैरे पहिल्यांदा आणि मग मी
नाही
तुम्हाला
मॅडम,
हँड
एक
ओव्हर
एक
करते.
एक हो, मला एक फक्त क्वेरी आहे.
हा
यात स्लाइड शेअर हा ऑप्शन, कारण मला झूमचं माहिती, यात मला नाही लक्षात येत आहे. हॅलो.
ओके. स्लाइड शेअर.
सर स्लाइड शेअर मध्ये ना आपण
स्लाइड शेअरचं
यामधलाच
ऑप्शन मला.
गेल्यानंतर राईट साईडला ना इथं आपल्याला प्रेझेंट म्हणून येतं बघा सर, राईट कॉर्नरला.
बरं.
प्रेझेंट मध्ये म्हटलं ना अ विंडो येईल सर. यू आर प्रेझेंटिंग
रसशास्त्र
म्हटलं
इज
ना.
प्रेझेंटिंग. हो
हा,
हो.
यू आर प्रेझेंटिंग
हां
बरोबर. तिथे क्लिक
हां.
केल्यानंतर अ
त्यात आता
विंडो ओपन होईल.
हो बरोबर, करा क्लिक. हां
हा,
हां.
अ विंडो
ठीक
ओपन
आहे. हां
झाली ना सर, तुम्ही आधीच बॅकग्राऊंडला
हो
तुमची पीपीटी ओपन ठेवा.
हो. बरं. हां ठीक आहे. शेअर नाव. हां.
ओके. आणि नंतर जेव्हा सर
बरोबर.
तुम्ही प्रेझेंट म्हटलं, शेअर म्हटलं की तुमची पीपीटी स्टार्ट होऊन जाईल.
हो. बरं बरं. हां राईट राईट. आत्ता येत आहे.
ओके.
ठीक आहे सर.
ओके. हां, थँक्यू सर.
ओके थँक्यू. हां मॅडम.
करायचं सर स्टार्ट.
हो हो करूयात.
येस. ओके सर.
हॅलो.
Yes. Good morning, all. I welcome all the students and our honorable guest speaker in today's webinar. Today's topic is chronopharmacology, recognition and application. Before starting webinar, I would like to introduce our today's speaker, Dr. Raman Pelke sir. Actually, due to time limit, I am going to introduce sir very shortly. Presently, Sir is Professor and HOD, Department of Rasashastra and Bhaishajya Kalpana, Shri Ayurved College, Nagpur, PG Guide, PhD Scholar at MUHS Nashik, Member Syllabus Reform Committee, CCIM New Delhi, Ex-Principal, Shri Saptashungi Ayurved College and Hospital, Nashik, Ex-Member, Board of Studies, MUHS Nashik, ex-PG in charge, Shri Ayurved College, Nagpur, ex-Vice Principal, Shri Ayurved College, Nagpur. Sir received award of Best Article of the Year 2003 in Ayurved Patrika. Best Teacher in Shri Ayurved College, Nagpur 2017. Many paper presentations are done by Sir. More than 30 conferences attended. More than 50 research publications are there. 37 review articles published in Ayurved Patrika Nashik. Sir worked as organizing secretary at many committees, keynote speaker, center web observer, center in charge, examiner, paper setter, moderator, etc. etc.
No?
Now I requested our honorable speaker, Dr. Raman Pelke sir, to take a charge and continue the session. Please, sir.
नमस्कार मॅडम. am I audible?
Yes, sir. Yes,
मॅडम.
sir. Yes, sir.
Okay.
You are audible.
चला नमस्कार. Right. So before I start, let me thank my mother institute. Basically, Shri Saptashringi Ayurved Mahavidyalaya is our mother institute because we had worked there for 12 years, right from 2013, 2002 to 2013. So basically, thanks a lot, Chondikar ma'am and Department of Rashastra for offering me this opportunity to deliver my lecture on chronopharmacology. So, madam, should I start? Hello.
Yes, sir. Yes, sir. Please, sir.
Okay. So, is the screen visible, ma'am? Hello. Hello.
Yes, sir.
Madam, uh, screen दिसतंय नीट?
सर इथे नाही
Hello.
ऍक्च्युली मुलांना दिसत असेल कारण तुमचं प्रेझेंटेशन इथे
बरं.
दिसतंय सर.
Right. Okay. Right. Okay. So, ma'am, this is regarding chronopharmacology, recognition, and application. So, basically, chronopharmacology is a rather new term for our Ayurved people. But if we link this term with Aushadhi Sevankal, then it becomes a familiar term. So, myself, Raman Belge, madam has recently introduced me. फार जास्त सांगितलं त्यांनी. मी फक्त श्री सप्तशृंगी आयुर्वेद महाविद्यालयात काम केलेला एक शिक्षक ही माझी खरी ओळख आहे. आणि आजही ते प्रेम कायम आहे. So, friends, we know all these vital organs like heart, kidneys, liver, stomach, and all other organs. Friends, do you think these vital organs they behave similarly throughout the day and night? So we expect that these organs, these vital organs, should work with similar energy throughout the day and night. But do you think it's so? So let us see. These are emojis we often uh, post on our WhatsApp group. So by 6 a.m., I'm happy. By 12 noon, I'm tired. And by 6 p.m., I'm totally drained, totally discharged. Why so? So it should be the same thing, same happiness, same energy level. But do you think it remains so? No. Why? So the answer to this question remains in the term chronobiology. So chronobiology is a science dealing with the phenomenon of biological rhythmicity in living organisms. So it's nothing but a biological rhythmicity observed in living organisms. Then what is chronopharmacology? So it is the pharmacological aspect of chronobiology. So the pharmacological aspect of chronobiology will be chronopharmacology. And then chronopharmacology will nothing but the Aushadhi Sevankal mentioned in our Ayurvedic text. So, friends, I came to know that you are UG and PG students. So, you must have gone through the terms like circadian rhythm. These are a few biological rhythms like circadian rhythm that is a body cycle of about 24 hours. Ultradian rhythm, a body cycle of less than 24 hours. While infradian rhythm, it's a body cycle of more than 24 hours. The term circadian was coined. Ha, ha. Hello. मला सर इथे स्टॉप शेअरिंग येत आहे तर परत करू माझ्याकडे शेअर होत आहे बरं हो हो हां हो सर येता येता हॅलो हो ना प्रेझेंटिंग हो ना बरं बरं एक मिनिट हा Hello. Hello. Sir. Hello. 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 दिसतंय ना? बरं. मला असं वाटतं याच मोडमध्ये मी सुरू ठेवतोय. ठीक आहे. So should I start? Hello. Okay, okay. So friends, we were discussing right. So we were discussing the biological rhythms. There are three types of biological rhythms, like circadian rhythm. This term was coined by Franz Holberg, widely considered the father of American chronobiology. It is the body cycle of about 24 hours. The other biological rhythms like ultradian rhythm, that is of less than 24 hours, while infradian rhythm, it is the body cycle of more than 24 hours. Now, rationale of chronotherapy according to modern sciences. Basically, what is the importance of chronotherapy? It is basically to release the drug at desired time, pathological need of disease, considering the circadian rhythm, to improve the therapeutic efficacy and patient compliance. Effective for treatment of diseases caused due to circadian changes in body like asthma, peptic ulcer, rheumatoid arthritis, osteoarthritis, then to maximize desired and minimize undesired drug effects, for programmed delivery of hormones, and lastly to deliver higher amount of drug at required time. So when we were discussing to deliver higher amount of drug at required time, this should be considered as a loading dose. Now friends, before we proceed, let us have a look at the Shastrokta Chikitsa Kal as described by Charak Samhita. So Chikitsa Kal depends upon the factors like Dina, Rugna, Aushadha, Vyadhi, Jirnalinga and Rutu. Dina includes Vaman, we know that it has to be taken during Pratah Kal. Rugna like Pratah, Niranna Kal. Aushadh like Abhakta Kal, Sabhakta Kal. Vyadhi, so in case of Jvara, the Peya consumption should be 6 hourly. For Jirna Linga Lakshan like Shudhaveg, Sharira Laghutva, and Rutu like Hemanta Kapha Sanchay. We know the Shatkriya Kal like Hemanta Cheteshleshma Vasantesa Prakupeti. So these are the Chikitsa Kal we need to focus during offering medicines. Now, these are the Chikitsa Kal according to Charak Samhita. There are 10 Kal. So if it is Bhuktadav, then that should be indicated in Apana Vikruti, while in Samana Vikruti, it should be Bhukta Madhye. Bhukta Pashchat having two categories. So after lunch, be given in Vana Vikruti, while after dinner, be given in Udana Vikruti. Muhurmuhu is indicated for Shwas, Kas, Trishna. So these are few emergency conditions where a Muhurmuhu Kal is indicated. Samudga is offered in Hikka, while Bhakta Sanyukta is Aruchi. Sagras in Pranavayu Vikruti and Grasantre also in Pranavayu Vikruti. So Pratah Kal is meant for Balvan Rugna, that is empty stomach, while Niranna Kal, it is for Durbala Rugna, because Pratah Kal, but to be taken after Laghu Patyahar. So friends, as we had just seen, these are 10 Aushadhi Kalas depending on the Vayu Vikruti and Bala of the Rugna. Now, Aushadhi 7 Kal according to Sushrut Samhita. Again, these are 10 Aushadhi Kalas like Abhakta, contraindicated in Sukumar, Bal, Vruddha and Stri Rugna. While Pragbhakta Kal, this is meant for this being Shigrapaki, hence safely be given in Sukumar, Bal, Vruddha and Stri Rugna. Adhovakta Kal is indicated in Urdhva Shariragat Vyadhi and its Balya. Madhyavakta Kal in Kushthagat Vyadhi. Then Antarbhakta Kal, Sabhakta Kal is Hrudya Manobalvardhak Deepana and be given in Stri Rugna and Nirbal Rugna. The other Kal like Samudga is meant for Urdhvagami and Adhagami dosh. Muhurmuhu Kal in Shwas, Kas, Hikka and Vaman. Gras in Vajikaran and Mandagni patients, while Grasantar is indicated in Vamaniya Dhumpan, Shwas and Mandagni, and a specific preparation in the form of Leh be given in during this Kal. Next is Ashtang Sangraha. So these are 11 Aushadhi Kal. Again, Abhakta Kal is meant for healthy person and it offers unobstructed srotasas of Amashay. Pragbhakta Kal, diseases of lower half of body, then Apana Vikruti and obesity. Madhyabhakta Kal is Saman Vikruti, Koshtagat Rog and Pittaja Rog. Adhabhakta Kal is meant for Urva Jatrugat Rog, then Kafaja Rog and Karsha. And again, two subtypes. Van should be for Vana Vikruti, it should be after lunch, and for Udana Vikruti after dinner. Samabhakta Kal be given in Sarvanga Vedhi and useful in Balak, Sukumar and those who hate medicines, Aushadha Dveshi Rugna. Antarbhakta Kal is meant for Vanavedhi and 3 hours after lunch or dinner and useful in those with a better Jatragni. Samudga Kal be given in Hikka, Kampa, Akshepa, Urdhva, Adha or Parshva Vedhi and it can be given in the form of Pachana, Avleha or Churna. These are few kalpas. Muhurmuhu again meant for Shwas, Kas, Hikka, Trusha, Chardi and Vishaktata and it can be given empty stomach. Sagras and Grasantare, these are meant for Prana, Vayu, Vikruti and Sagras is meant for Vajikaran while Grasantare is also meant for Rutrog and can be given in the form of Churna, Leha, Gutti and Vati. And lastly is the Ratrikal. It is meant for Urdhva Jatrugat Vedhi and Vamaniya Dhumapan. So friends, these 11 Aushadhi Kal, they depend basically on the Vayu Vikruti, Vedhistan and certain disease conditions. Peculiarity of Ashtang Sangrah lies in the kalpas like Churna, Avleha, Gutti, Vatti, etc. It seems to be a more practical approach. Then lastly, Sharangdhar Sanhita. So Sharangdhar Sanhita is basically prescribed 5 Aushadhi Kal, but these 5 Aushadhi Kal are further subdivided into 10 Aushadhi Kal. So Suryodaya Jataha is indicated in Pittaja Vedhi, Kafaja Vedhi, Virechan, Vaman and Lekhan. Divas Bhojane, if it is Bhojana Purva meant for Apana Vikruti, Sagras for Aruchi, Bhojana Madhya for Samana Vikruti and Bhojan Paschat for Vana Vikruti. Sayam Bhojane, so if it is for Grasantare or Sagras meant for Udana Vikruti and Bhojana Paschat for Pranavayu Vikruti. Again, Muhurmuhu is meant for those emergency conditions like Trusha, Chardi, Hikka, Shwas, and Garavish. So medicine can be given with or without food is the peculiarity of Muhurmuhu Kal. And Nishi is the Urdhva Jatrugat Vedhi and Lekhan Brihan. Now let us see this Kal with special reference to their indications, contraindications, and mode of action. So first one is Niranna Kal. We know Bheshaj is administered on empty stomach. Bheshaj not mixed with food, hence becomes most potent. Hemadri says that once the consumed food is digested, Bheshaj is given and after its digestion, food is given. Indu says that Bheshaj be given 2 hours after sunrise. So mostly this is during 5 a.m. to 6 a.m. Activity of Bheshaj is highly patent due to its non-contact with food. Bheshaj virya remains unchanged and Agni and Bheshaj interaction unobstructed due to absence of food. So indications like Agni Avastha should be, it is Pradipta Agni, Prabal Vadhi and patient in Durbal Rugna to be taken after Laghu and Patyahar. In contraindications of Nirannakal, those patients having debility, then again children, pregnancy, female patients, Doshakshay and Dhatukshay Rugna. Side effect is severe balakshay since the medicine is highly potent, and glani. What is the physiology of sharir during Niranakal? That amasha and srotasas are rikta of kapha. Bheshaj interacts directly with Agni. Agni at all levels like Jatragni, Bhutagni and Dhatwagni could be stimulated. Accomplishment of the Saptadhatu Prashastatva, so useful for the Rasayan 7. So most of the Rasayan treatment be given during Niranakal. Next is Pragbhakta Kal. Here, Bheshaj is administered before meals. Hemadi states that Bheshaj intake is immediately followed by food. Activity of Bheshaj, that Ashupak of Bheshaj, no Balaksha as the food follows the Bheshaj. No mechanical expulsion of Bheshaj due to intake of food. Indications like dosh apan vayu vikruti and diseases like debility, weakness of lower parts of body, adha parshva, then mutravaha, malavaha and shukravasrutasans, and pakvashagat vyadhi like arsha and gudabhramsham. We have seen that hingvashtak should be consumed prathama grase. Physiology of sharir during this pragbhaktakal. Bheshaj intake is followed by food, thus it is the first target of Agni and not the food. The Bheshaj admits elective affinity for Amasha and eradicates the doshas involved in Amasha. Third one, Madhya Bhaktakal. Bheshaj is administered in between meals. Chakrapani and Indu says that first have 50% of food intake, then get the Bheshaj and then take the remaining food. Activity, Bheshaj acts locally and eradicates the sthanic doshas. And stimulation of the Saman Vayu is the peculiarity of Madhyabhaktakal. Indications, dosh Saman Vayu Vikruti and Pitta, Agni Manda, and disease like Koshtagat Vyadhi, Pakvashagat Vyadhi, Shula, Gulma, Grahani. Physiology of the Sharir, the Bheshaj is compressed by food at the upper and lower end, so it cannot spread and is forced to act locally. So this is locally acting Aushadikal. The systemic action of the Bheshaj on Dosh and Dhatu is delayed. As Samanvayu and Pachak Pitta are both situated in the Koshta, this Kal helps to control Paitik and Koshthagat Vadhis and Samanvayu Dushti. These all Aushad 7 Kal will be described with special reference to the modern era diseases. Now, Adhobhakta Kal, here Bheshaj is administered after meals, so after lunch and after dinner. Hemadri and Indu says Bheshaj is to be administered immediately after meals. For Vanavikruti, it should be after lunch, and for Udana Vikruti, it should be after the dinner. Activity of Bheshaj, the Urdhvagati of Udana Vayu facilitates the Bheshaj to enhance the strength of the upper part of body. So this is basically meant for Urdhva Parshva. Indications like Vanvayu Vikruti and Udan Vayu Vikruti. So diseases of Vanvayu Vikrutjanya like Napunsakatva, debility, shofa, jvara, depression, body ache, tingling, numbness, kushtha and visarpa, while Udan Vayujanya like throat infections, depression, chardi, aruchi, penis, galaganda and urdhva chatrugat vadhi. Physiology of sharir for this kal, that is after lunch is stimulation of van vayu, while after dinner it is the stimulation of udana vayu. Then antarbhakta kal, here previously consumed food is digested and bheshaj is consumed. After metabolism of bheshaj, again food is taken in the evening. This is the peculiarity. Activity of bheshaj, it shows vrudya, pathya, deepana and manobalakar effect. Indications like van vayu and diseases again of van vayujanya diseases. Physiology of sharir during antarbhakta kal, it is due to madhyana, that is pitta kal. Agni is in a stimulated condition, so bheshaj is properly metabolized during this kal. Sixth one is sabhakta kal. Bheshaj is mixed with food. Indu says that bheshaj is processed or cooked along with food, or it is given with food. Activity of bheshaj to maintain the integrity of bala and agni. Indications like diseases arochak, aruchi, sarvang samshrit vadhis, and patients like women, old children, debilitate who exhibit unpalatability to medicines. So all those Sukumar Bal Rugna be given medicine during Sabhaktakal. And physiology of the Sharir, its systemic action on the doshas and dhatus is observed. Seventh one, Samudga Kal. Samudga means petika or box. So bheshaj is administered immediately before and after food. Indu and Himadri says that bheshaj should be consumed immediately in relation to the food. Bheshaj acts as a samudga or box for ahar. Activity of Bheshaj, it helps in correcting the Gati Vikruti of Vatadosh by promoting Anuloman of Vatadosh. So basically, Samudakal is for Vatanuloman. Indications like Apan, Van, and Udanvayu Vikruti. Types of dravyas like Pachan, Avlihan Churna be given during Samudgakal. Diseases like Hikka, Kampa, Akshepak, Vataja Prameha, Shukradosh are to be treated with Samudgakal, and patient who consumes light food be given medicine during Samudgakal. And physiology of Sharir during Samudgakal, like Hikka, Kapha, and Vata doshas are involved. Kapha is situated in the Urdhva Sharir, while Vat in the Adha Sharir. Bheshaj administered during Samudgakal pacifies doshas at the upper as well as lower parts of body. Akshepak doshas are localized in Pani and Pada, so Samudga Bheshaj acts on both the extremities of body. Eighth one is the Muhur Muhukal. Bheshaj is frequently administered irrespective of Bhukta or Abhuktavastha. As I had already stated that this being emergency condition, it is irrespective of the food intake and hence can be given on empty stomach. Activity of Bheshaj to maintain the constant level of concentration of the drug and make it more bioavailable, to provide more sublingual absorption of drug for faster action. Again, diseases like Pranavaha Srota Vikruti, that is Ashvaska Sikka, Udakvaha Srota Vikruti, that is Trushna, and Annavaha Srota Vikruti like Chardi and Visha. Physiology of the Sharir, all the indications being life-threatening need immediate therapeutic intervention. So, Muhurmukal is one of the most important kalas. Then Grasakal, Bheshaj is administered with each and every morsel of food. Arun Datta and Himadri says that bheshaj be mixed with each morsel of food. So when we say that bheshaj is administered with each and every morsel of food, एक उदाहरण आपण सांगायचं तर पेरू खातो पेरूची फोड खाताना आपण दर घासाला मीठ लावतो आपण सो इट शुड बी द प्रॅक्टिस व्हाईल ऍडमिनिस्ट्रिंग ड्युरिंग ग्रासकाल. Activity of bheshaj, Gras bheshaj facilitates absorption of the bheshaj right from the buccal mucosa and reaches systemic circulation and thus promotes rapid onset of action. Indications to stimulate Agni, then Pranavayu Vikruti like Pinas, Ardit, Trishna, Shwas, and Bheshaj, all those Vajikaran Bheshaj, Churna, Leha, Deepana Dravya, and Vati Guti. Physiology of the Sharir during Graskal, normal Pranavayu regulates the intake of food, as had been mentioned in Ashtang today. Grasakal Bheshaj stimulates the Pranavayu, so the Indriya Prasadan and Chitta Prasadan takes place. This enhances the Vrusha Prabhav of the Vrusha Dravyas. In Grasantar Kal, Bheshaj is administered between two morsels of food. So activity of Bheshaj, it helps in correcting the Gati Vikruti of Vatadosh by promoting Anuloman of Vatadosh. Indications like Pranavayu Vikruti, then types of Dravya would be Leha form, diseases like Pinas, Ardit, Trusha, Shwas, Rudru, meant for Vamana and for Kasagna Dhuma. Physiology of the Sharir during Grasantar Kal would be normal Pranavayu regulates the intake of food as we have seen already in Grasakal. So Grasantar Kal Bheshaj stimulates the Pranavayu. So the again Indriya Prasadan, Chitta Prasadan would take place. And lastly, the Nisha Kal. Bheshaj is administered after digestion of consumed food. Hindu says that Nisha Kal is the time after evening meal is digested and 3 hours have passed. So here evening meal means Suryaste. So if you consume meals by say 7 a.m. or 6 a.m., then it would be around 9 to 10 p.m. Sorry, if you take it by Suryasta, that is 6 p.m., then it would be by 9 p.m. or say late by 10 p.m. Activity of bheshas is the elective affinity of the bheshas towards the urdhva jatrugat parts. Indications again urdhva jatrugat part, so kafadosh, type of dravya like pachana, shamana, diseases like urdhva jatrugat vadhi, then the purpose is lekhana and bruhana. Physiology of the sharir, Sharanga says it is the ananna condition, and Charak says that Hrudaya is Mlan, Srotasas are Avruddha, Ahar is Kledakarak. So Kapha Vruddhi, Pitta Vruddhi Kal is there, and Agni is Manda. So during this Nisha Kal, proper medication meant for the indications be given, and then Chir Parinaman of the Shaman Aushadhi takes place. So after discussing these Aushadhi Kalas, let us have a look at the limitations. So as we had already seen, all those Bhaishatkala are meant for Shaman purpose only, particular Vadhi and Bhaishatkal. So very few Vadhis have been mentioned like Visha, Kas, Pipasa, where Muhurmuhu Kal is given, and Kampa Akshepak, where Samudka Kal is indicated. So if Bhaishatkal is not clearly mentioned, it can be decided on the following basis, like Dosha involved in the pathogenesis, sthana of the Vadhi, and status of Agni. These are few indications like Arsha, Pragbhakta Kal, Grahani, Madhyabhakta Kal, Galamaya, Sayam Bhakta Paschat, Pandu, Pratah Bhakta Paschat, Vishamajvar, Pragbhakta, Madhyabhakta, and Bhakta Paschat, Vaivaranya, Sayam Bhakta Paschat, Pinasa, Nishakal, Gulma, Madhyabhakta, Pragbhakta, while Vatabalasa, Pragbhakta, Adhobhakta, and Pratakal. So friends, these were the Ayurvedokta Kal. Now let us review the modern diseases with special reference to their chronological behavior. Basically, we are interested in the modern day diseases, and let us correlate with these diseases with our Aushadhi Sevan Kal. So if it is bronchial asthma, all of us know that bronchial asthma precipitates after midnight or at early morning hours. Myocardial infarction, 34% events occur between 6 a.m. and noon. Acute cardiac arrest and transient myocardial ischemia occurs increased frequency in morning is observed. Cause is release of catecholamines, cortisol, increase in platelet aggregation and vascular tone. These are all modern findings. Hypertension is observed during 6 a.m. to 10 a.m., where systolic BP rises at the rate of 3 mmHg per hour and diastolic BP rises at the end of 2 mmHg per hour. Cerebrovascular accidents take place during 10 a.m. to 12 noon. Incidence increases during evening and midnight. Other conditions like osteoarthritis worsens in the middle or later portion of the day, while rheumatoid arthritis pain is observed early morning compared to daytime. Why? Because increased concentration of C-reactive proteins and interleukin 6 in blood. So rheumatoid arthritis will worsen in morning hours. Ankylosing spondylitis, pain intensity is 3 times higher and stiffness is 8 times higher between 6 to 9 a.m. than between 12 to 3 p.m. So again, ankylosing spondylitis would worsen during morning hours. Allergic rhinitis worsens in early morning hours upon rising. Peptic ulcer disease, its symptoms worse in the early hours. The other conditions like gastrointestinal symptoms worsens in early AM. Most of the drugs are lipophilic and they have more rate of absorption in early mornings rather than any hour of the day. We know duodenal ulcer, so ulcer exacerbation during midnight. Why? Gastric acid secretion is highest at midnight. So these are few conditions. Then diabetes mellitus, we know very well. It increase in blood sugar level is observed after meals. Attention deficit syndrome, increase in dopa level in afternoon. Cancer, most important disease. DNA synthesis is normal in normal human being. In normal human bone marrow cell have a peak around noon. DNA synthesis in normal human bone marrow cell have a peak around noon, while in DNA synthesis in lymphoma cells is near midnight. So keep this point in mind. DNA synthesis in lymphoma cells is near midnight. Depression, seasonal affective disorders in susceptible people during the short days of winter. So that is say from October to January. Then growth hormone secretion is observed in markedly increased during midnight, but is reduced during the later stages of sleep. Now, friends, can we correlate this information of chronological behavior of these modern day means modern diseases along with our Aushadhi Seven Kal? We have seen this Shvasa. So for Shvasa, it was Muhurmuhu Granthokta Kal. Now we had seen that bronchial asthma, it precipitates after midnight or at early morning hours. So can we offer a loading dose of our Shvasahar Kalpa at midnight followed by maintenance dose at Muhurmuhu Kal? So that will solve the purpose of Muhurmuhu Kal and also the chronological behavior where the disease precipitates after midnight. So according to me, it should be loading dose at midnight followed by maintenance dose at Muhurmuhu Kal. Then hypertension. So for hypertension, if it is morning hours 6 a.m. to 10 a.m., if it increases, then according to us, if it is Vanavikruti, then Pratah Bhukta Paschat should be the ideal Aushadhi Sevan Kal. But since it is, we have seen chronological behavior in morning hours, so a loading dose of our antihypertensive medicine be given Suryoday Jatah, that is Pratah Kal, and then maintenance dose during Pratah Bhukta Paschat. Rheumatoid arthritis. So we had seen that rheumatoid arthritis worsens in morning hours compared to daytime. So if it is Sarvanga Vedhi, then Samabhakta Kal should be ideally prescribed. So according to chronological behavior, loading dose in the morning, that is 5 to 6 a.m., followed by maintenance dose at Samabhakta Kal. Then attention deficit syndrome. So if it is during Mano Balavardhan and his Samabhakta Kal, so we had seen that increase in dopa level in afternoon. So I would suggest that for Pratah Sabhakta Kal should be the ideal Aushadhi Sevan Kal, followed by Sabhakta Kal. Then growth hormone related diseases. So we had seen that secretion is markedly increased during 12 midnight and reduced during the later stages of sleep. So if I wish to offer any growth hormone related kalpa, it should be ideally given before midnight, that is Nishakal. Then cancer. I had already told you that DNA synthesis in lymphoma cells is near midnight. So if it is near midnight, then I should ideally prescribe it during Nishakal, that is near midnight. Since cancer is not directly mentioned in our Ayurvedic texts, so I just can't quote the Granthokta Kal meant for cancer patients, but we can correlate it appropriately, and a Nisha Kal should be proper Kal for administering a loading dose. I don't know, you might have studied the cancer with special reference to Panchtikta Ghrit. One of my PG students, she had done her study on breast cancer cells. It was a cell line study, and we had found promising results of Panchatikta Ghrit in breast cancer cell line studies. Now, friends, let us move forward to the other Aushadhi Sevan Kal, other aspects of Aushadhi Sevan Kal. We all know that Parpati Sevan be done in Bharani Nakshatra. With Pushya Nakshatra, we used to have that Punsavan, and currently we are having Suvarna Ghrut Prashan. So Suvarna Ghrut Prashan, it is those special camps are held at every Pushya Nakshatra that takes place at almost 28 days interval. Then Shravani Purnima, this during Shravan Purnima, consumption of Panchagavya is practiced. Why Panchagavya? So a few points that will help us understand better the importance of consumption of Panchagavya during Shravani Purnima. This is again regarding Aushadhi Sevan Kal. So previously it was Aushadhi Sevan Kal during a day. This is during the Rutu. So if it is fresh cow dung, then enteric organisms like typhoid, tetanus, TB bacteria, vaccinia virus, urine being acidic, antitoxic, attenuation of microbes. Milk is a medium to protect attenuated microbes. Same as curd, it protects attenuated microbes, and ghee offers enteric coating. Friends, colon also offers an opportunistic site for oral delivery of vaccines. Vacca in Latin is a cow. Colon is rich in lymphoid tissue, therefore, the uptake of antigens through the colonic mucosa may lead to rapid and local production of antibodies. The uptake of antigens through the colonic mucosa may lead to rapid and local production of antibodies. So, Shravani Purnima, we used to have the booster dose of this oral vaccine in the form of Panchagavya. Now, new dimensions that affect chronopharmacology in Ayurveda. Here I had quoted few kalpanas like Parpati Kalpana. All of us know it's an entry-coated preparation, Ayurvedic preparation. It's an entry-coated targeted delivery at the site of colon. We know Grahani Kalpa. So Parpati is meant for Grahani Avaya and Grahani Vadhi. So my question is, can other Ayurvedic drugs be administered through Parpati form? Because that offers you a sustained release preparation at a particular intended time. Again, this is a pulsing cap system that is well known as capsules. These are different types of capsule where the capsule body comes in contact of dissolution medium. The hydrogel plug swells, and after a long time, the plug pushes itself outside the capsule and rapidly releases the drug. So this could be called as a sustained release or a timed release medicine. So can Ayurvedic medicine be administered through capsule so that a proper Aushadhi Sevan Kal can be adjusted, can be attained with special reference to the chronobiological behavior of the disease. Last example is the transdermal drug delivery formulation. A transdermal film made of Boswellia serrata, that is Shallakya and Curcuma longa, Haridra, proved to have anti-rheumatic activity. Friends, तुम्हाला सगळ्यांना माहिती असेल, पूर्वी आपण बेलाडोना या नावाची पट्टी लावायचो काही ठराविक व्याधींमध्ये, आणि त्यामध्ये आपण जे करायचो दॅट वॉज द ट्रान्सडर्मल ड्रग डिलिव्हरी फॉर्म्युलेशन. अगेन माय PG स्टुडंट, शी इज स्टडिंग the Langley transdermal patch for inducing delivery. So again, what Bhaishyajakal be suggested for this transdermal drug delivery formulation, because again it offers you a controlled drug delivery so that a proper Aushadhikal can be attained. Conclusion. So we had seen that Aushadhi 7 Kalas are 10. 66% of these Bhaishyajakal are described in relation to food, the others are in relation to Vayu. Sushrut did not mention the Aushadhi Sevan Kal as per the Vata Dushti, meant for Shaman Chikitsa only. Oral route of administration is advocated. The rate of metabolism of Bhaishyas by Agni is controlled by food with the aid of proper Bhaishyajakal. So that is the peculiarity. Useful for creating awareness among biologists, clinicians, and pharmacy scientists. So the persons with whom we are working, they are now inquiring, then what should be the ideal time to prescribe medicines? Useful to develop new tools for the treatment of classical diseases as well as the modern lifestyle disorders. Already well established active pharmaceutical ingredients can be effectively used for the treatment of various diseases. Uh, Before I forget, let me discuss the COVID-19 condition, where a chronological behavior. Actually, I tried to refer a lot of research articles, but I couldn't find a proper chronological behavior of COVID-19 virus. So, in one of the research articles, I found that chronological behavior indicates consumption of medicines before sunrise and before sunset. I repeat, chronological behavior indicates consumption of medicines before sunrise and before sunset with special reference to COVID-19 patients. So if at all I wish to prescribe Ayurvedic medicine for this condition, then it can very well be given before sunrise and before sunset. In nutshell, chronopharmacology helps to release the drug at desired time, considering the circadian rhythm, depending on the dosha prabhav, dosha gati, to improve therapeutic efficacy, and patient compliance, to treat the disease caused due to circadian changes in body, to maximize desired and minimize undesired side effects, for programmed delivery of medicines, and to deliver higher amount of drug at required time. Due to time constraint, I had limited myself to a few diseases. We can discuss lot of diseases. So this image of dart, सगळ्यांनी पाहिलेला असेल हा गेम. So what is the peculiarity of this game? The person who hits the center, that is core, will score maximum. So for maximum efficacy, we need to have accuracy. We need to focus the target. We need to decide the target first and then focus, then hit it. We need proper skill. We need proper force. So this accuracy, this focus, the targets, the skill, the force, all these will help us if we study, if we administer the medicine with the help of knowledge regarding circadian rhythm, dosha prabhav, dosha gati, program delivery, sustained release, all these factors be considered while prescribing medicines, and that will offer us a proper uh, prabhav of Ayurvedic drugs. So, lastly, I thank you all. My special thanks to Honorable Balsabahar sir, Himgauri ma'am, Principal Dr. Aware sir, then my erstwhile colleagues, Chondikar ma'am, then the other staff members of Rashastra department like Apeksha ma'am, Sanjay Khedekar sir, Ketke ma'am, the honorable faculties who had accompanied me in all those my years of working with Shri Saptashringi Ayurved Mahavidyalaya, and my dear Eugene PG students. So thanks a lot for a patient listening. Thank you.
Very knowledgeable and conceptually clear webinar, sir. I am really
Thank you,
thankful
ma'am.
to you on
Thank you,
behalf
ma'am.
of all students and all listeners. I am thankful to our Honorable Chairman Dr. Balasaheb Ahir sir, Himagauri Adke ma'am, Principal Dr. Milind Avare sir, Vice Principal Dr. Vaibhav Fartare sir, to allowing us for webinar. Special thanks to HOD and Professor Dr. Shailaja Chondikar ma'am for guidance, and my colleagues Dr. Ahire sir, Potkule sir, Dr. Sagre sir, Dr. Kiran Shinde sir, Rahul sir for their kind support. And last but not least, all of you students and listeners. Thank you so much. Thank you so much,
Thank,
sir.
thank you, ma'am. Thank you.